Each episode of Brain Health Unchaining Your Pain with Dr. Ruth Allen is for educational and demonstration purposes only. The information shared in each episode should not be interpreted as medical advice. This episode should not be used to self-diagnose or self-treat any health, medical, or physical condition. Do not use this episode to avoid going to your healthcare professional or to replace the advice they give you. Consult with a trusted healthcare professional before doing anything contained in this episode. If you have any questions or concerns, please contact www.ruthmaryallen.com/connect. Welcome to the show, Brain Health Unchaining Your Pain. I am really looking forward to this episode because I have been joined again by the wonderful Dr. Leo Galland. Welcome to the show, Dr. Leo.
So nice to be with you again, Ruth.
It's so lovely. And for those that don't know Dr. Leo Galland, he's spent the last 40 years treating patients with complex chronic illnesses. He's developed innovative approaches to evaluation and treatment that's helped to create the foundation for functional medicine, and his latest focus has been on the reversal of long COVID. And I know that we connected because I had COVID back in 2000, I think it was now, and I stumbled across your website and you just gave everything that I needed to know and all the steps I needed to take, and you kindly gave me some guidance as well. So I'm so thankful because by taking the action that you recommended, I have thankfully, fingers crossed, not developed long COVID, and I've had it twice now. So really appreciative of the information that you provide to help others. So thank you once again for coming on the show to share your wisdom.
Well, my goal over the past couple of years has been number one, to try and help people understand how they can prevent the late complications of COVID-19 by understanding the changes that occur in the body when you get COVID. And I've been able to measure these changes in some people who think they fully recovered. I like to track them and make sure that there's a return to normal afterwards.
And I think it's so important, isn't it? Because there's been so much misinformation and there's been a huge educational curve just in the medical community of our understanding of what COVID is and what the long-term consequences can be if we aren't cognizant of how it interacts with our body and what knock-on effect it can have, not only to the way in which it enters our system through the respiratory tract, but also the way in which it can impact every single organ of our body, depending on what our risk factors are to the virus attacking us from an entry perspective.
Right, you're absolutely right. And the thing about this virus is it enters, as you said, as a respiratory infection, but it really impacts the blood vessels and blood flow. And through that, it then impacts the health of all of the organs, and it creates changes in those blood vessels and consequently in the clotting system in the body, so that there are disturbances even in healthy young people who appear to have fully recovered. Abnormalities of blood flow can be detected for months and months after they recover from COVID-19. And there are really a few types of patterns that have been described in terms of the late consequences of having COVID. The concept of long COVID is that you never really get well. That is, you get the illness, but there are these lingering symptoms that last for varying periods of time. And some people, they don't spontaneously go away 2 years later. They're still there. And this has been described even in children. A recent large review and meta-analysis found that at 3 months, 16% of children still had at least one symptom associated with COVID, which is, that's obviously quite disturbing. There's another pattern in which the person seems to get better, but then something happens and symptoms are created. It may be the symptoms that you originally had when you had COVID, or it may be some additional or different symptoms. And that's a second pattern. And but aside from the obvious illnesses that are called long COVID, or the symptoms that are called long COVID, there are changes. There are other things that happen after COVID-19. There is an increased risk of heart attacks, diabetes, high blood pressure, kidney problems, gastrointestinal problems, and neurologic problems that may occur, that's been documented over the let's say 15 months after the onset of COVID.
And just a time bind that, if you wouldn't mind, sorry for interrupting, is when the risk increases, and I know we may not have enough data yet, but do we know over what time period that risk is present? Does it diminish, or does it stay omnipresent for the rest of your life?
Yeah, that hasn't really been well established.
Okay.
Because they'll look, so far researchers have only been able to look at blocks of time, 12 months, 15 months. Yeah. So I haven't seen that graph. Yeah. And then the other issue is there's some people that have underlying disorders. Maybe they weren't even paying attention to them, and those get worse afterwards. Autoimmune disorders, for example. People who are seen predisposed to autoimmunity, based upon a variety of factors, have a doubling of their risk of developing some kind of new autoimmune disease afterwards. Okay. So it's my belief that all of these problems derive from the same alteration in the physiology of the body produced by COVID-19. And I created a diagram about a year and a half ago, a graphic called the Web of Long COVID, to try and explain that. I first created it to help me understand all of the research that I was uncovering, but then I realized that this is a tool that I can use to communicate with people. And that I feature on my website. And
that's in your latest document as well.
Yes, right. And I think I would say it stood the test of time, because every time I see a new research study, and I spent probably 4,000 hours in studying the research since the beginning of the pandemic, in addition to treating patients. And every time I see a new research study, it has a place in the web. Yeah. And more importantly, if I can identify where it is in the web, it helps me understand it better. It's not just a massive information. And I think one of the biggest problems with COVID and with long COVID is the lack of clear communication and understanding about this disease and what we know about it. And so there's this aura of like, here's a mysterious monster that's coming. And that's very damaging to the people's psyche. I've gotten so much feedback about, from what I've put together, which basically starts with, thank you for explaining this.
Yeah, thank you.
Yeah, now I understand it. I understand my symptoms. I understand what's going on. I think that's the first step. And that was my first goal, is to try and help people realize that, this is complicated, but it's not some terrible mystery disease. It may be terrible, and it may be very hard to treat in some people, but there are actions that can be taken, and there are things that you can do yourself that, and the self-care definitely works best the earlier you implement. And one of the things that really encouraged me to pursue this is, in my own practice among patients that I started treating for COVID at the onset of their illness, hardly anybody went on to get long COVID.
Which is amazing.
Yeah, it said, what that said to me is, okay, I think I really understand the factors that are driving it. So if we can deal with them at the time of infection, then we can move things through to a full resolution.
Yeah, so it's kind of prevention, but at the very outset of the infection occurring, which I think is so important, and because it's such an integrated functional medicine approach that you take, which is absolutely fundamental to addressing COVID, because it starts at a cellular level. It's a cellular assault, that you need to look at the whole system, and where that assault has occurred and how far the web stretches,
Right.
as you describe. So I wondered if we could go back to the basics of where the assault starts in our body, for those that may be not familiar with it, and take it right back to basics,
Sure.
so people can understand what happens when you have an attack. You're under attack from the virus.
Right. Well, the virus has to get into your cells to make you sick. And so it needs to find some protein, usually on the cell surface, that acts as a receptor or gateway. And in the case of COVID-19, the main gateway, it's not the only one, but it is the main one, is an enzyme called ACE2. And this was also the gateway for the SARS virus 20 years ago. And those are the only two viruses that target ACE2. The thing about ACE2, when I read this in March of 2020, when researchers said, oh, it's the same gateway, my first thought was, oh, well, let's find a way to block that. And that's going to help people not get sick. Well, the problem is ACE2 is a critically important enzyme for your body. And it functions to reverse the effects of inflammation and infection. That is, when you get infected with something, your body mounts a strong defensive attack. Basically, the best defense is a good offense. So
good counterattack.
You go into war mode and attack mode. That can cause a lot of damage to your own cells. And so ACE2 is there to counteract that, bring things back to baseline. If you lose ACE2, and that's what the virus does, that when it enters cells, it damages ACE2, it destroys it, destroys its activity through multiple mechanisms. So when that happens, you now have difficulty controlling the inflammation, the blood clotting, the scarring that occurs. And so the first part of what I think is important is restoring ACE2 activity as the infection is being fought and in its aftermath. And that can be achieved through aspects of diet and lifestyle. And there are a number of nutritional supplements. Vitamin D is one, for example. And there's a lot of data indicating that the level of vitamin D in your body has a major impact on the outcome of acute COVID. I haven't seen anybody look at it in terms of long COVID. There are natural products that I recommend. Curcumin, which was shown to decrease the severity of acute COVID and actually to decrease the inflammatory response to the COVID vaccine. That can be very helpful. And that also raises ACE2 levels in the body. Resveratrol.
I took both of those when you, with your advice, and that was really super helpful.
Yeah, I think those things plus diet. I mean, there's a high fiber polyphenol rich diet has an impact. So that's really at the center. Now, the second aspect of this is mitochondrial damage. And mitochondria are responsible for most of the energy that's produced in your body. They have a major impact on cell function. They also have an important impact in the immune system. And when your immune system goes into an attack mode, it mostly moves away from mitochondrial activity towards something called aerobic glycolysis, which is the way that cancer cells derive their energy also. This is very efficient for certain purposes, but it's a real high risk for us. And so restoring mitochondrial function is part of bringing the immune system back into a state of balance. And this virus has many ways to impair mitochondrial function. All infections, mitochondria take a hit with any kind of infection.
Which is why we get so energy depleted, because it's like our battery. It's the equivalent of a battery in your torch, and it produces redox signaling molecules or electrons, if you will, as the analogy, and then the ATP, which is your energy. And when you hit the battery and deplete it, that's why we get. And
and when your ATP levels drop, certain other systems kick in that may be helpful in fighting the infection. But when it comes to recovering, you really want your immune system in particular, and probably to be able to move over into mitochondrial energy. Mitochondria is its source of energy, and so mitochondrial support can be very important, especially if there's fatigue, if there's ongoing fatigue and trouble recovering. And I think that's one of the reasons why this is not a virus that you should try to exercise through. You really need to give yourself a break when you have it. Like, don't go sweat it out and, go for a run or go to the gym.
Yeah, don't run your battery flat when it's already flat.
Right. So, there are a number of things that support mitochondrial function. The specific, and there are virtually no drugs that'll do that. The specific substance, natural product that has the best data for it is coenzyme Q10, which is, and supplementation with coenzyme Q10 and sometimes certain vitamins can really impact mitochondrial function. And the vitamin B3, niacin, is tops on the list, but B1 and B2 also have an effect. And there have been some studies with ME/CFS that have shown the impact of especially CoQ10 and special forms of niacin.
So just to summarize for those that are listening, because I know you've mentioned a lot, is you've got two things that you have to focus on. The first thing is you need to restore your ACE2 because they get depleted because they get attacked as the virus enters your cell. And Dr. Leo Galland's mentioned many ways in which to do that: vitamin D, an appropriate diet, fiber, curcumin, resveratrol. I don't know if I've met omega-3, vitamin C. I don't think you mentioned those, but they all support your ACE2, building your ACE2, but particularly curcumin and resveratrol really helpful with vitamin D optimized. And then the second one is making you restore your battery powerhouse in your cell, which is your mitochondria that get depleted because they get attacked too. And it's important that you use the appropriate interventions to restore that, and coenzyme Q10 is one of the main players for that, which you can get as a supplement.
Right now, in the web of long COVID, radiating out from those from the center, that's the center of the web, there are strands that sit, each of them I named after some kind of physiologic disturbance. The names, there's limited amount of room for writing on that web, so I had to simplify things. But probably two of the most important. One is damage to the lining of blood vessels, which is called endotheliitis or endothelialitis. And that occurs, that's virtually universal with COVID. It even may be produced by the vaccines. Because it doesn't require live virus. That spike protein binds to the lining of blood vessels. It attaches to ACE2. And it can create inflammation on its own.
And there's quite a strong movement here in the UK actually by Dr. Aseem Malhotra, who is a very strong advocate to not being vaccinated. I don't want to go into the detail here, but there's lots of information for him that, as to the risk factor that you just mentioned on some types of virus.
Well, look, I would say that when it comes to COVID in a large part of the population, the data indicates that the vaccines actually have had beneficial effects on serious illness and mortality. And I think I understand the reason, but that's a whole separate discussion. The antibodies produced by vaccination are different than the antibodies produced by natural infection. And for a high-risk person who gets an acute infection, that's actually safer.
It's beneficial.
Okay, yeah. The impairment in blood flow occurs all over the body, including the brain. You can measure it in the retina of the eyes, in the tissues under the tongue, in the skin. Those are the easiest to measure. But it does occur in the brain, and it persists for 8 months, maybe longer afterwards. And that may be associated with the brain fog. It occurs in the lungs, and there it may be associated with shortness of breath. There's so many people that have consulted me, and they've said, I just don't have the same breathing capacity since that I had before COVID. Well, I've had my heart checked out. There's nothing wrong with my heart. I've had my lungs checked out. They're perfectly fine. Yeah, the issue there is there actually has been a loss of the smallest blood vessels, tiny capillaries in the lungs as a result of this infection, and they need to be rebuilt. And in fact, there's a study that came out recently that found two markers in the blood that could predict long COVID with 96% accuracy compared to healthy people. They didn't look at people who had fully recovered, but this could tell you who has post-COVID symptoms. And they're both markers that indicate the body is trying to build more blood vessels. That seems to be a near universal component of long COVID. Now, ACE2 plays an important role in the creation of new blood vessels and in the health of blood vessels. So that's the first thing that I turn to. But there may be other measures that can help blood vessels heal, and that's that's an area that's being explored. There are possibilities. There's a drug that not available in the UK or the US readily that was shown to do it, called sulodexide. It's a quasi-natural product, actually. Pycnogenol, which is derived from the bark of the French maritime pine, and that's available as a supplement globally. That was shown to help with the damage. And then there's an amino acid called arginine that was shown in people who have fatigue post-COVID, like 6 months later. Arginine supplementation helped their fatigue. And what arginine does is, it was a combination of arginine and vitamin C, but the arginine was the real driver of it. It was about 3,200 milligrams a day. And what arginine was shown to do was to improve blood flow. So arginine's a little tricky, though. I mean, every aspect of this is tricky, because if you happen to have a reactivation of a herpes virus infection after COVID, arginine is food for herpes viruses.
So you definitely don't want to be taking that.
You don't want to just, there's not a one size fits all. You have to, and that's the way the document that I have on my website, long COVID prevention and treatment, it's about 50 pages. It was designed to try and help people figure out, this is relevant to me. The blood vessel damage then creates a tendency to form blood clots. And so I didn't mention omega-3s earlier, because omega-3s are very helpful. Aspirin can be helpful in preventing or reversing blood clots. Sometimes you need to go with medication that you can't just use yourself. The third component that I think is, and I'm not going to try to go through the entire
that's okay.
But the third component that is very important for people is something called mast cell activation. And mast cells are these primitive cells in your immune system. They don't really circulate in blood. They're in your tissues, and there are not very many of them, but they're very powerful. And they release about 200 different chemicals when they're activated, including histamine, which is probably the best known mast cell chemical. And those do several things. Number one, histamine actually increases the ability of the virus to enter your cells. It also it also can aggravate the endothelial, the blood vessel inflammation. It can aggravate blood clotting. And a lot of people find that the use of antihistamines is helpful during long COVID. And there actually was a controlled clinical study which used a type of antihistamine that's not used for allergies. It's used for heartburn and ulcers, famotidine. And it found that this was a placebo-controlled randomized trial in people who had experienced cognitive dysfunction and emotional distress post-COVID. Famotidine at a dose of 40 milligrams twice a day produced a significant improvement compared to placebo. So that's something else that many people have tried and find helpful. And once you, what I found is among the patients that I've been treating who are not responding well to the basic things like the mitochondrial enhancement, the ACE2 enhancement, attempts to improve blood flow or deal with clotting, especially for people who actually have adverse reactions to the things that help everybody else, that almost all of those people have mast cell activation occurring. And that's the 800-pound gorilla in the room. You have to deal with calming the mast cells in order to be able to move on. And mast cell activation is strongly associated with some of the neurologic complications that occur, sort of at the level of damage to organs. The most common and troubling of which is POTS. Which positional orthostatic tachycardia syndrome, in which your heart races when you stand up. So if you're lying, so you might feel better, pretty good if you're lying or resting. You get up, you can't stand for a few minutes. You really need to rest. That phenomenon of orthostatic intolerance is one of the major neurologic complications. It's strongly associated with mast cell problems, but sometimes has to be dealt with on its own, and with a lot of fluid and salt to expand your blood volume, sometimes with special support hose. There are drugs that can work. There are some natural products that I mentioned that have been shown to help slow the heart rate. Vitamin B1, thiamine. Some people do better with a gluten-free diet who have the postural tachycardia. And the exact reason for that hasn't been worked out, but it is a controlled observation. Vitamin D is important for those people. Melatonin, they also have a beneficial effect.
Which is difficult to get hold of here in the UK.
Oh, it is. Okay, well, it's not like a wonder treatment, like, let's, there are a lot of things that can help individual patients, and sometimes it's small increments. And the pattern of exercise. If you have orthostatic intolerance, one of the biggest problems is you're going to curtail your activity because you feel so much better when you're not upright. So you can start doing supine exercises with stretch bands and things like that. And I have some links to sources you can go to for that. And I also have a link to a video that I put out on mast cell activation and a whole section kind of describing therapeutic approaches. Another aspect that I think is very important and that does not really receive enough attention is the relationship with the gut and the gut microbiome and the phenomenon of leaky gut. ACE2 is expressed on the cells that line the small and large intestine, and the virus infects those cells. And one of the and it damages ACE2. Now, one of the effects of that is that ACE2 in the gut has a role that it doesn't have any place else in the body, where it is involved in the transport and absorption of amino acids, especially tryptophan. Now, tryptophan is just an essential amino acid with many critical roles in the body. We know it best because it's the precursor of serotonin, and so it affects mood. But tryptophan also undergoes other metabolic changes in the body that impact the immune system. So the malabsorption of tryptophan that may occur with COVID-19 can impair immunity in the gut. And that then leads to changes in the microbiome, this collection of 100 trillion organisms that lives in your GI tract. And there's a lot of speculation. And let's just say that just as blood vessel changes are virtually universal with COVID-19, alterations in the gut microbiome are virtually universal. And at first, some of my colleagues said, well, that's the reason people are getting sick, because their gut microbiome is all screwed up. Well, that may be true for some people, but I've seen people who were really healthy before COVID, and they had great lifestyles, and were just shattered by long COVID. And what the study seemed to indicate is that COVID-19 itself can alter and destroy the structure of your gut microbiome.
Oh, wow,
and,
that's
and
incredible.
can then there's certain critical organisms that are lost. The one that's been the most constantly shown to be lost is called Faecalibacterium prausnitzii. You can't get it; it's not available as a probiotic supplement, but it is what's called a keystone species. It supports the growth of bifidobacteria, for example, and bifidobacteria get lost as well. And it is a major producer of a short chain fatty acid called butyrate. Now, butyrate is not only important for gut health, but it's absorbed. It has anti-inflammatory effects throughout the body. It gets to the brain, and it helps the brain restore itself after injury. So paying attention to restoring a healthy gut microbiome is very important. And studies have shown that what happens with people get COVID-19, butyrate goes down, Faecalibacterium prausnitzii goes down. In people who recover, they come back. In people who develop long COVID, they don't. And that's a kind of critical turning point there. I think, based on the limited amount of data that's available for who's going to recover and who isn't going to recover. And then there are some other organisms that actually can overgrow. And in a study that looked at how does the microbiome at the time of acute illness predict who's going to get long COVID, loss of butyrate and loss of Faecalibacterium prausnitzii was one. But there was also the overgrowth of another species called Ruminococcus novis. Okay, again, impossible names to remember, but that group of organisms, the ruminococci, they produce some toxic metabolites that are bad for your brain. And in a mouse model, those metabolites were shown to accelerate age-related cognitive decline. One of the things that you'll read about is having COVID, your brain ages 10 years. Well, that could be a result of the isoamylamine that's released by the ruminococci. So one of the things that I really try to pay attention to is trying to reverse the gut dysbiosis, and as a result of gut dysbiosis, you get leaky gut.
Which then causes more infections.
Which then causes more inflammation, and bacteria can actually get into the blood. Probably one of the most feared complications of COVID in children is this thing called MIS-C, multisystem inflammatory syndrome in children. And that is associated with evidence of leaky gut, and treating the leaky gut helps all the other treatments for it get better.
And I think the key protagonist parking COVID for leaky gut is often gluten.
For a lot of people, it is.
The structure of gluten, there's been in loads of episodes we talked about this, but the structure of gluten has changed in the last 50 years. And so we've become more sensitive to gluten than we ever were, because there's more gluten in our diet than we ever used to have, and it's a slightly different structure. And so it's really important if you have a child that you minimize their gluten consumption if possible, to strengthen their gut lining.
Right. And in addition to that, there is the loss of bifidobacteria, because bifidobacteria actually break down gluten. They actually secrete enzymes that help to break down the peptides, and to break down the protein and the peptides in gluten, and make them less damaging. So I would say, as a culture, we start out probably with a bifidobacterial deficit. You then get COVID-19, it aggravates it. And there are also effects of, there are other environmental effects, but I agree with that one. And air pollution, exposure to the phthalates and plastics. Those alter the way the immune system works. and may negatively impact the effect of long COVID. Well, we all have microplastics in our bodies, so I'm not sure exactly what we can do about that at this point, except to find ways to compensate for the exposures that we have.
Yeah, and I don't know if we are actually able to detox microplastics from our system.
I haven't seen anything that that tells me about that. I'm looking into ways to overcome the effects of phthalates on immunity, and I think there is a route to doing that.
And for people that are listening who have the symptoms of long COVID, what would your recommendation be for those that maybe, let's start with the different types of issues that people may have, and I know it's difficult because everybody's unique, but people who have lung problems where they are struggling to breathe, or they're lacking in the ability to do the normal function that they would do.
I try to deal with that aspect also in the document. Almost always the shortness of breath, sometimes it's due to asthma or a flare-up of an asthmatic problem.
And that's actually ACE2 deficiency anyway, isn't it?
Yeah, ACE2 has an impact on asthma. But most of the time, I think for those people who are really troubled and who are told, your doctor can't find anything wrong with your heart or lungs, it's loss of blood vessels in the lungs.
Okay.
And that's where, and there are some things that may be helpful there, including pycnogenol, as I mentioned. Another natural product called vinpacetine, which is derived from periwinkle, that was shown to improve blood flow in the lungs. Sometimes aspirin is helpful, omega-3s, because you have to also counteract the blood clotting. There are some, sulodexide, this product that's available mostly in non-English speaking countries. But I have located a pharmacy in Lebanon that will ship it internationally.
Okay.
And it's very safe. Has been shown to relieve the chest discomfort in a controlled study that people get after COVID, that it can be so hard to reverse. So that, for people whose main concern is with shortness of breath, I would really focus on blood flow and blood clotting as the route to overcoming that.
And those with cognitively, because it's all about brain health. Okay,
all right. Well, so the cognitive problems also involve blood flow.
Of course.
But there I specifically start, I look at two things. First of all, things like curcumin and resveratrol have been shown to help the brain. Butyrate has been shown to help the brain. So the ACE2 recovery, the gut microbiome are helpful. Omega-3 fats. And
we're mostly deficient on those, many people.
Right. Those have been shown to help brain recovery, as well as the outcome of acute COVID. And then alpha-lipoic acid, which is an antioxidant. It's good for the nervous system. There are hundreds of clinical trials with it. And that actually helps the omega-3s work better in the brain. So sometimes if you can deal with the mast cell activation, the cognitive function can improve. As I cited that study with famotidine.
Okay. Absolutely fascinating. And I know you mentioned all about the gut dysbiosis. So just key things that people can do there if they're struggling with their gut function.
Right. Well, a lot depends on what your GI symptoms are like.
Yeah, of course.
In general, a high fiber diet, high in fruits, vegetables, seeds, spices, and herbs. A high polyphenol, high fiber diet is the first approach. Sometimes quercetin, a bioflavonoid, is helpful for the gut. Probiotics can make a difference. And there actually was a study using a Mexican probiotic that found that it hastened recovery from acute COVID-19. A colleague of mine has found it helpful with long COVID. And there are 4 species in there. 3 of them belong to, or 4 strains. 3 of them belong to a species called Lactobacillus plantarum. Now, Lactobacillus plantarum as implied by its name, is found in plants. So sauerkraut, kimchi, fermented foods, especially vegetable foods, are sources of Lactobacillus plantarum, and they actually help the immune system recover. So,
and this is all applicable for kids as well, because
yeah,
kids
absolutely. Everything that I've said can be done with kids.
Yeah.
And so, but here's where a diet high in fermented foods may make a difference. Well, if you happen to have a major mast cell problem or histamine intolerance, you might not tolerate those. So that's why each person has to work out the path that is going to help them the most.
By looking at your spider's web, your web of COVID.
Yeah, and I've tried to put in the cautions, like, oh, watch out for this, because just because this is going to work for someone else doesn't, if you start noticing that you're having this problem, you better back off and go in a different direction.
Yeah. I think the key is also to get your fundamentals right. So, to focus on your diet and optimizing your diet, like you mentioned, with clean food, vegetables, fruit, fiber, nuts, seeds.
Yeah, right. And sleep, the right balance of rest and exercise.
Yeah.
And a healthy diet. Yeah. Those are really the fundamentals.
Yeah.
And, there was a study that was done. It didn't look at long COVID, but it looked at acute COVID. And it was done through Columbia and Johns Hopkins University in the States, and a couple of other major medical centers. It was an international study. They looked at healthcare workers, mostly male physicians, and they looked at the outcome of acute COVID in those people. These were all people who had survived, but they looked at, did they have a mild or asymptomatic infection or a moderate or severe infection? And they looked at their diet in the year prior to getting COVID. And a diet that was basically a pesca vegetarian diet was associated with the best outcome.
I think it was 70%, wasn't it?
Yeah, a major improvement. Whereas low carb diets were associated with a worse outcome.
Yeah.
Now, when you looked at the difference, it's not as if the vegetarian diets were truly vegetarian. They weren't, but they had twice as many vegetables in them as the low carb diets.
Yeah.
And a 40% increase in vegetable consumption was associated with a 70% decrease in the risk of severe COVID.
Yeah.
Now, I mean, if there was a drug that did that, it would be all over the newspapers.
Yeah.
Right.
Yeah, and isn't it amazing that we just need to go to our pharmacy with an F-A-M-R-M,
right.
Is often can be, more important in the first line of defense than to go to your drugstore.
Right. Now, I do want to add that I've seen people whose health was perfect and their lifestyles impeccable prior to COVID, who got shattered by COVID. And so it's not your fault that you get long COVID. Nonetheless, there are things that you can do. Getting the basics right is the beginning of it.
Yeah. And it's incremental. Everybody's unique, and we have to look at the person's unique, personalized perspective and work our way through that web to get to the root cause of the problem.
Yes. And hopefully over time, there will be more health practitioners who know how to help people who get stuck. Because, there are parts of this. If you've developed certain neurologic problems, especially, which I think are what really hang people up, you might have a hard time overcoming it through your own efforts, through the things that you can do. And one of the most challenging complications is this phenomenon inappropriately named called post-exercise malaise, or PEM. I mean, malaise does not describe what happens to people who are affected by this. It's more like post-exercise monster crushes you, and it can take days or weeks for you to recover. Which is why I really recommend that people go very slowly and listen to their bodies.
Yeah.
I've seen so many people who said, who consulted me and said, I was doing pretty well, but then I overdid it. And overdoing it is a fraction of what they had been able to do pre-COVID. And then I just crashed. And I haven't managed to come back since then. So I think a real awareness of how your body is doing, how much you can push yourself, is important.
Mm-hmm.
And especially because reconditioning is a really important part of the healing.
Yeah. And to restore your function back to a level that is acceptable for you. You can't
Yes.
just go fast and expect it to happen.
Right.
It's the same as losing weight, isn't it? We don't expect to shed 30 pounds in a week. If we want to restore our, the weight that we
Right.
want to be at, we have to go slow, because then it happens over the longer term. It's the same kind of principle. So it's been absolutely fascinating, Dr. Leo Galland. Thank you so much for all of your fantastic advice, as always. How can people learn more about you and how they can support themselves in recovering from long COVID?
Okay, well, I created a document, Long COVID Prevention and Treatment, which is posted on my website, drgalland.com. There's no strings attached, no charges. There's just information there that is an attempt to help people understand how COVID has impacted their body and steps that you can take to begin trying to recover.
Mm-hmm.
And there are a lot of references. There's information there you can take to your doctor.
Yeah,
if
it's
you can't
super
do it on your own.
digestible and shareable.
Yeah. Mhm.
So it's brilliant. Thank you so much, Dr.
Okay.
Leo Galland, for your wisdom and for your support. And then go to www.drgalland.com to find out more. And I think there's a direct link there, isn't there, on your website?
Yes. Mm-hmm.
To that. It's been fascinating. Remember, this show is all about brain health, unchaining your pain. You're not stuck with the brain you have. You have the power to make it better. And Dr. Leo Galland has kindly been here to show us how in the context of COVID. Thank you, Dr. Leo Galland. I really hope you enjoyed that conversation. Thank you so much for listening. Please be sure to like and share this episode and leave a review on my website or on Apple Podcasts. If you're looking for opportunities to optimize your brain health or unchain your pain from a past trauma, make sure you visit my website, www.ruthmaryallen.com, and use the code podcast10 at checkout to get 10% off all programs. And always remember, you are not stuck with the brain you have. You have the power to make it better. You have the power to unchain your pain and optimize your brain power and performance so that you can win back energy and time doing what you love.